This is a review of Chapter 1, Management Role of Dietetic Professionals. So let's start with registered dietitian and a dietetic technician. So registered dietitian nutritionist, or RDN, you may often heard them called as registered dietitians or RDs. This particular profession does require a 4-year degree in an accredited program through the Academy of Nutrition and Dietetics. They also do require an internship. These dietetic internships are typically 9 months to a year, depending on the internship, and they do require a board exam. A Nutrition and Dietetic Technician Registered, or NDTR, sometimes they're called DTRs. This also requires a 4-year degree in an accredited program through the ASCEND, or Academy of Nutrition and Dietetics, and it also is required to have a board exam. Now, I do want to mention that Arizona State University does have a degree program that provides the pathway for these two specific professions. They are our DPD, or Bachelor's Degree in Nutrition in Dietetics. This is our on-ground program. It is not available online and is a 4-year degree. Now, I understand that a lot of individuals are getting degrees online in nutrition. Maybe it's food management or human nutrition. Those specific degrees do not provide the pathway for these two professions, because these two do require a specific accredited program, which is overseen by the Academy of Nutrition and Dietetics. So our DPD program is the only one that is accredited, and that would provide these two potential pathways. Now, if you are interested in eventually becoming an RD or a DTR, and you are in one of our online degree programs or getting nutrition degree online, you will need to contact one of your advisors, or you can contact me directly. I'm actually the DPD director at Arizona State for these two programs, and I can help you with determining how you can go about getting your DPD classes completed. But I do want to let you know that it is an on-ground program only, and it cannot be completed online. Okay, so with that said, let's look at some different food management positions. You have a lot of opportunity here with a degree in nutrition, any degree in nutrition, honestly, from a food service director to a chef, to production managers, to even a food service supervisor. There's lots of opportunity, particularly in management within food service. So knowing that there's lots of opportunity in food service, let's look at the different types of food service that are out there and essentially how they serve their customers. And really the difference between what we're going to talk about in these next couple slides is, do they make money? Do they make a profit at the end of the day? Or are they really there just about feeding the individuals who come to that location? So let's start with commercial food service. These are businesses that are designed to make a profit, and they attract customers who have a choice about where they're going to eat. So if you think about any restaurant that you may have gone to, any fine dining, any quick serve, so if you go to Chipotle, or you go to Taco Bell, or you go to really anything, oregano's, those are all commercial food service operations. Supermarkets also fall into this same vein, and same with a food truck. So if you've ever eaten at a food truck, you can consider that a commercial food service operation. Now the other one to think about, we have commercial, and now we have on-site. On-site are designed to feed customers who work, reside, or attend a school in a facility. So these customers really have limited options, but they need to eat while they're there. It might be subsidized, like in school districts that follow or operate the National School Lunch Program. Those meals are subsidized by the federal government. It might be profitable, but any profit that they do generate goes back into the food service operation, whether that's to improve the quality of the food, to improve the equipment or the facilities that they are providing the food. This can include things such as daycares, senior centers, schools, prisons. So if you think about it, you don't go to a hospital for dinner, right? If you don't sit down with your significant other on a Friday night and say, where do you want to go to eat tonight? And they say, let's go to our local hospital cafeteria, right? That's not the case. But when you go visit somebody in the hospital, sometimes you get hungry and you need to eat. So they recognize that they need to feed people while they're at their location receiving services for other things. And so they're providing food service options for those clients that come through. So I didn't want to include, or at least expose you to these terms for different types of food service. So you have for-profit or nonprofit, and within each of those operations, they can create or make their food in different ways. Conventional, commissary, ready prepared, or assembly serve. I am not going to go into the nuances of these terms, nor do you need to know them yet. You will actually see, and we will talk more about these in 445, which is Management of Food Service Systems, which is another course that I teach. And we go into depth in these different definitions. So you will see these again, but it's just at least an exposure of the terms and know that they are affiliated or related to different types of food service. But let's talk about who manages different types of food service on site. So one of them is self-operated. So if you can think about an independent, one-of-a-kind, they're like a mom and pop. They make all of the decisions, they generate the menu, they essentially work for that business or institution. There's no board of directors that oversees this operation. There are some advantages to this. They can be very responsive to the needs of the parent institution. So if they are running a hospital food service operation and they are self-operated, if that hospital, say a patient service manager, decides that they want to change or add in a new menu item, they can do that quite quickly. There's no discussion with upper management, with corporate headquarters in order to make that change. And they can be very creative with their offerings. Again, there's not a lot of standardization happening. Typically, not a lot of lots of layers of management to have to go through to get approval. Some disadvantages of this is typically they may see more higher food costs. Reason being is they are not able to purchase high volume amount to get that smaller or that per unit discount. So an example, if you shop at Costco or Sam's Club, right, you like to go there because the per unit cost of the item is usually lower, right? You can buy a whole case of toilet paper for, a very low cost, and when you look at the price per unit, it's much lower than what you would have paid maybe for a roll of, 4 toilet paper rolls at the local grocery store. So you're saving in the per unit price. They don't necessarily have that in self-operated because they're only purchasing for that one location. They also have to develop their own menus and recipes, which if you've ever been in that kind of situation, you know that sometimes that takes time, especially developing recipes and standardizing those recipes. You've may had the experience of making a recipe the first time and realized, oh, that didn't work, or oh, that needed more salt, or maybe if I add a little bit more flour the next time it would work. And so it's a lot of trial and error. So this would have to occur at the site itself, and as you know, that takes time and money for that to occur. The other option for on-site food service is instead of self-operated, they hire a company to come in and operate that food service for them. So this is known as contract management. You may be familiar with the company names of Sodexo or Aramark. They are basically hired by the business or institution to come in and run their food service. So, for instance, say ASU, we know that while you're on campus, you're here to learn, obviously, and to attend courses, but you need to eat or might want to eat while you're on campus. And Arizona State knows that they are not experts per se in running a food service operation. So they hire a company to come in and run that for them. And that company charges Arizona State a fee to do that each month based on the volume and the amount of locations that they have. Now, Sodexo will come in and employ all the people, so they hire and fire, they provide menus, they purchase all the food, and they run the operation, and then they charge a fee to do that. So some advantages, they do have obviously a lot of resources for menus and for recipes because they are a large organization that feeds multiple locations across the world, really. So they have a lot of resources to pull from. And because of that, because they're so large, they have a buying power. So they typically pay lower food costs. Some disadvantages to this, managers have maybe two different reporting relationships. So they may have to report to the management company itself, as well as the institution that they are providing their services to. So as a manager, I might have to report to Sodexo, and I may also have to report to a management team at Arizona State. In it, they may also have increased paperwork because there's billing involved, right? If you're billing an organization for your services, you need to show documentation of what it is that you did for them, how many meals you served, the amount of food that you purchased, and so forth. They also are standardized, which is an advantage, right? Things are the same across the board, but it doesn't provide a lot of opportunity for change or to have a unique program. So things are going to be pretty standard. What you see in one location will be the same in another. Some people like this. Some people find this more problematic. Let's talk real quickly about a couple of trends in food service. Fresh, sustainable, locally grown foods. This has been an ongoing trend. People like to know where their food is coming from, that it's locally sourced, trying to help with the green movement and, reducing your carbon footprint. And a lot of health types of trends, whole grain options, reduction of, trans fats and sodium, different strategies to help deal with obesity. There was actually legislation put into place a couple of years ago to help with the labeling of calories on menus. So if you've ever been to any chain restaurant that's large, like a McDonald's or a Burger King, you may have noticed that they list the calories associated with each menu item. This is to give the consumer more information to make choices when they are choosing what they're going to eat for that meal. Other things to think are different trends that are current. Trained culinary professionals in on-site food service. I see this more in schools, particularly K-12 schools, where they're bringing in professionally trained chefs to create some new menu items and maybe infuse some more locally grown, more fresh type of items on their line. Customer satisfaction, that's always been a focus in food service, but maybe more of a stress on service and trying to keep that customer happy. I have seen a lot more trends on on-demand food service, which is really like room service, as an example, in hospitals, where it's no longer a set time that they serve food. So breakfast is no longer a specific 8:30 tray line or 7:30 tray line. They have an open hour of 8 to 10 for for breakfast, and then the patient calls down to the kitchen. They have a specific menu that's left in their room, and they can select from a variety of different items that they would like when they'd like them. So it's no longer a set time. It's really left up to that patient to determine when they're hungry and when they'd like to order their food. I do want to just briefly go over some of the management positions that you might see in a hospital. The list of them is here. We're going to go through the nuances of each of them in the subsequent slides. So, clinical nutrition manager, this is usually the individual responsible for the overall nutrition care of patients who are admitted to the healthcare facility. Sometimes this is also known as your chief clinical dietitian. They list them here separately. I think depending on the operation, you could have them separate. But sometimes in smaller institutions, like a small rural hospital, you would see this as one and the same. So a chief clinical dietitian could be a managerial title of a dietitian who manages the clinical nutrition area, and he or she may also do direct patient care in addition to that. So not just overseeing all the dietitians, but then also on the floor and managing their own patients as well. A patient service manager, they're typically the ones that manage food service for the patients, and they oversee the food service staff. So they might be the ones who the diet aides report to, who may take in the orders, who are on the tray line, such as that. A clinical dietitian, this is a registered dietitian who works in a healthcare setting, and they provide nutrition care to patients. Remember, these are typically, well, not typically, but these are the individuals who have that 4-year degree from an accredited program, went through the internship, and then a board exam. And the last but not least, you have a clinical NDTR. And depending on the operation, they can be the ones that manage tray line. Sometimes this is the patient service manager. DTRs are usually on the floors with RDs. They typically go in and screen new admit patients for any kind of nutrition risk. And then if they identify a nutrition risk, then it's flagged for the RD to follow up with that patient. There are other avenues of nutrition management positions, and this is more in the public health arena, so stepping out of the hospital and now into the community. You might have a public health nutritionist who oversees any kind of public health program, and they may be overseeing different community agencies like WIC and such. Community dietitian or community nutritionist. These are usually RDs giving direct patient care or to clients. Usually they do have some sort of management skills. So management's going to come out in a lot of different areas regardless of what your role is in nutrition. Here are some more examples of that: agency management, dairy council, WIC, and the like, Meals on Wheels. Other management positions include healthcare, which we've talked about already, and also in different types of companies, such as the contract management companies that we talked about earlier. Industry is a large one, so you could work for Dairy Council or the Beef Council or the Nut Council or the Avocado Council. It's amazing to me how many foods have councils, but there's always opportunity within those different organizations. Sales and marketing, supermarkets, education, nutrition policy, all of those have types of management opportunities within them. And then entrepreneurial. Obviously, if you're an entrepreneur, you own your own business, you are managing your own business or your own company, and that obviously takes some management skills and a lot of different volunteer opportunities too. You might be in higher level or a president of an organization that's a volunteer basis, but you have some sort of management skills or leadership skills that may be involved. So we are going to talk a lot about in this course things that you think about or should think about when you are in management roles, how a manager fits into the scope of the organization, leadership types of skills, and things that you need to consider when you're in these management roles.